Pediatric physical examination is a comprehensive assessment that is crucial in evaluating the health and development of children and adolescents. It involves a series of systematic checks to identify any signs of disease, developmental issues, or potential health problems. Here's a detailed overview tailored for medical and dental professionals or students. A. Characteristic features of pediatric examination. Approach. The pediatric examination requires a gentle, patient, and flexible approach, considering the child's age, developmental stage, and comfort level. Environment. Ensure a warm, welcoming, and child-friendly environment to put the child and caregivers at ease. Equipment. Use pediatric-sized medical equipment for accuracy and comfort. B. Clinical presentation and diagnosis. General appearance. Assess the child's level of activity, alertness, and interaction with the environment. Note any signs of distress, dysmorphic features, or developmental delays. Vital signs. Measure age-appropriate vital signs, including heart rate, respiratory rate, blood pressure, temperature, and oxygen saturation. Growth parameters. Plot height, weight, and head circumference on pediatric growth charts to assess for any deviations from expected growth patterns. C. Systematic examination. 1. Head and neck. Inspect the head shape, size, and fontanelles in infants. Examine the eyes for alignment, movement, and any abnormalities. Assess the ears for position, shape, and any signs of infection. Evaluate the mouth and throat for dental health, tonsil size, and any lesions. 2. Respiratory. Inspect for respiratory effort, retractions, and use of accessory muscles. Auscultate lung fields for breath sounds, wheezes, crackles, or diminished air entry. 3. Cardiovascular. Palpate peripheral pulses, comparing symmetry and strength. Auscultate heart sounds for rate, rhythm, and any murmurs. 4. Abdominal. Inspect the abdomen for distension, scars, or masses. Palpate gently for tenderness, liver, spleen size, and any masses. 5. Musculoskeletal. Assess joint mobility, muscle tone, and strength. Evaluate spinal alignment and any limb deformities. 6. Neurological. Assess cranial nerve function, motor and sensory function, and reflexes and coordination. 7. Skin. Inspect for rashes, lesions, bruises, or signs of infection. 8. Genitourinary. Inspect external genitalia for normal development and any abnormalities. In infants and toddlers, check for diaper rash or signs of infection. D. Special considerations. Developmental assessment. Evaluate the child's developmental milestones appropriate for their age, such as speech, motor skills, and social behaviors. Immunization status. Review and update immunization records according to the recommended schedule. E. Prognosis. The findings from a pediatric physical examination can guide the prognosis and management of any identified issues. Early detection of developmental delays, growth issues, or health problems can lead to timely interventions, improving long-term outcomes. Differential diagnosis table. Symptoms, sign. Possible condition: failure to thrive, malnutrition, chronic diseases, developmental delays, autism spectrum disorders, cerebral palsy, recurrent infections, immunodeficiency disorders, dysmorphic features, genetic syndromes, abnormal heart sounds, congenital heart defects, respiratory distress, asthma, pneumonia. High yield points. Pediatric examinations require adaptations based on the child's age and developmental stage. Growth parameters are crucial for assessing overall health and development. A thorough, system-by-system examination can uncover potential health issues that may not be apparent through history taking alone. Developmental assessments at various stages are key in identifying delays or disorders early. Immunization status should always be checked and updated to prevent communicable diseases. The physical examination of a newborn is a critical assessment conducted to identify any immediate health concerns, congenital anomalies, and to establish a baseline for future growth and development. This examination is typically performed shortly after birth and then repeated during subsequent well baby visits. Here's a concise guide. A. Characteristic symptoms and pathophysiology. Transition from fetal to neonatal life. Adaptation processes include changes in circulatory and respiratory systems post-delivery. Physical maturity assessment. Gestational age assessment through physical and neuromuscular findings to identify preterm, term, or post-term infants. B. Clinical presentation and diagnosis. General appearance. Assess for activity level, posture, tone, and any signs of respiratory distress. Skin. Note the color, texture, presence of birthmarks, rashes, or lesions. Assess for jaundice, cyanosis, or pallor. Head and neck. Examine the shape, sutures, and fontanelles for size, tension, and closure. Eyes. Check for symmetry, red reflex, and any discharge. Ears. Note position and form. Assess for any skin tags or pits. Mouth. Inspect for cleft lip palate, Epstein pearls, and assess the sucking reflex. Neck. Palpate for masses. Check clavicles for fractures. C. Systematic examination. 1. Respiratory. Observe for rate, effort, symmetry of chest movements, and listen for breath sounds and any abnormal noises. 2. Cardiovascular. Palpate pulses. Auscultate for heart rate, rhythm, and the presence of murmurs. 3. Abdominal. Inspect for distension, umbilical cord stump condition. Palpate gently for organomegaly and masses. 4. Genitourinary. Inspect external genitalia for normal development. Palpate for testes in males and inspect labia in females. Note the presence and location of urinary meatus. 5. Musculoskeletal. Assess hip stability and symmetry of limbs. Check for polydactyly or syndactyly. 6. Neurological. Evaluate primitive reflexes, e.g. Moro, grasp, rooting, and suckling reflexes. 7. Verify patency by confirming passage of meconium. D. Prognosis. Early identification. Prompt detection of abnormalities can significantly influence management and prognosis. Developmental monitoring. Continuous monitoring is essential for tracking growth, development, and early intervention when necessary. Differential diagnosis table. Possible condition, respiratory distress, transient tachypnea of the new respiratory distress syndrome, jaundice, physiological jaundice, blood group incompatibility, abnormal heart sounds, congenital heart disease, patent ductus arteriosus, hip instability, developmental dysplasia of the hip, abnormal reflexes, neurological disorders, birth trauma. High yield points. A comprehensive newborn exam covers general appearance, vital signs, and system-by-system assessment to detect congenital anomalies and assess adaptation to extrauterine life. The examination of the skin, head, eyes, and mouth can reveal common newborn conditions like jaundice, cephalohematomas, and oral thrush. Cardiovascular and respiratory assessments are crucial for detecting congenital heart diseases and respiratory conditions. Neurological evaluation, including the assessment of primitive reflexes, provides insights into the central nervous system's integrity. Monitoring growth and development through serial examinations is essential for early identification of developmental delays or disorders. Incorporating a variety of physical examination topics into medical education is essential for developing well-rounded clinicians. Here are several key areas and specific assessments that medical students, guided by a professor such as a prof or MD, doctor, might be expected to learn and perform. 1. Cardiovascular examination. Inspection. Observing for jugular venous distension, chest wall deformities, or visible pulsations. Palpation. Feeling for the apex beat, heaves, or thrills. Auscultation, listening for heart sounds, murmurs, gallops, and rubs. NAR 2, respiratory examination, Inspection, noting respiratory rate, rhythm, use of accessory muscles, and chest symmetry. Palpation, assessing for tracheal deviation, chest expansion, and tactile fremitus. Percussion, determining lung fields resonance and detecting effusions or consolidation. Auscultation, identifying breath sounds, wheezes, crackles, or diminished air entry. 3. Gastrointestinal examination. Inspection, observing for distension, scars, or visible peristalsis. Auscultation, listening for bowel sounds and any vascular sounds. Percussion, assessing liver span, shifting dullness for ascites. Palpation, feeling for tenderness, masses, liver and spleen edge. 4. Musculoskeletal examination. Inspection, noting posture, deformities, swelling, or asymmetry. Palpation, assessing for tenderness, warmth, or effusion in joints. Range of motion, active and passive movements to assess joint function. Strength testing, evaluating muscle strength against resistance. 5. Neurological examination. Mental status, assessing alertness, orientation, memory, and language. Cranial nerves, testing all 12 cranial nerves for sensory and motor function. Motor system, assessing muscle tone, strength, and any involuntary movements. Sensory system, evaluating touch, pain, vibration, and proprioception. Reflexes, checking deep tendon reflexes, superficial reflexes, and pathological reflexes. 6. Dermatological examination. Inspection, examining the skin, nails, hair for lesions, rashes, or abnormalities. Palpation, feeling for texture, moisture, temperature, and turgor of the skin. 7. Head and neck examination. Inspection and palpation of the scalp, checking for lesions, lumps, or tenderness. Examination of the face, assessing facial symmetry, involuntary movements. Thyroid gland, palpating for enlargement, nodules, or tenderness. 8. Eye examination. Visual acuity, testing with a Snellen chart. Visual fields, confrontational field testing. External examination, inspecting eyelids, sclera, conjunctiva. Ophthalmoscopy, examining the retina, optic disc, and blood vessels. 9. Ear, nose, and throat examination. Ear examination, inspecting the external ear, auditory canal, and tympanic membrane. Nasal examination, inspecting the external nose, nasal passages, and septum. Oral and pharyngeal examination, inspecting the oral cavity, teeth, gums, and throat. High-yield teaching points, integrated approach, teaching the importance of integrating findings from different parts of the physical examination to reach a comprehensive clinical assessment. Clinical correlation, encouraging students to correlate physical findings with potential underlying pathologies. Patient communication, emphasizing the importance of clear, compassionate communication with patients during examinations to ensure comfort and cooperation. Documentation, training in the clear and precise documentation of physical examination findings in the patient's medical record.